We're now ready for questions. The first question will come from Terry Gainey of the Columbia Tribune and will be directed first to Kenny Hulshof. Terry?
Just a few blocks from here, there's a couple, Alice and Jeff Van Dyke. Jeff Van Dyke was born with spinal muscular atrophy, and in December he was diagnosed with leukemia. His wife Alice is disabled. She has diabetes and lupus and a back injury from working on the job as a licensed practical nurse. 3 years ago, under the state's Medicaid system, the couple was paying $126 a month for care that enabled them to have somebody to come in their home and provide in-home care. The rules were changed 3 years ago, and now the couple pays $850 a month for this same coverage. The couple declared bankruptcy. They live in a house that is paid for by the generosity of their church, which also provides their utilities. It's been suggested to them that they get divorced to deal with this situation. They've considered moving to another state where the Medicaid laws are more affordable. If you were governor, what, if anything, could you do for Jeff and Alice Van Dyke?
Thanks, Terry. Appreciate the question. Something that we've put out a very aggressive, bold initiative called Healthy Missouri Access Exchange, Health Max for short. And here's how it works. First of all, unlike other suggestions that we simply take the 750,000 Missourians currently on Medicaid, now HealthNet, and increase that number to 1 million, 1 out of 6. What we have proposed with Health Max is, it's 90 seconds, isn't it? I'll talk faster. What we propose with Health Max is a comprehensive plan that first of all deals with those that are on the low economic rungs of our state ladder that no longer qualify for Medicaid. We would help subsidize those health savings accounts. We do this in a market-based arena. So we provide then health savings accounts and pay the premiums. The state would pay the premiums for the couple that no longer qualifies for Medicaid. The population that is just next above, as far as the next rung of the ladder, as far as the economics here in our state, we would provide some tax incentives, again, for them to look within a plan within Health Max. And then we add to the risk pool, and here is the caveat where the insurance companies cringe a bit. They would have to cover any person in Missouri if they wanted to participate, regardless of pre-existing condition. But the way that we make it palatable for them is to have an inclusionary risk pool. And Kenny08.com has all the details, and I'd invite you to go there to look at it.
Thank you, Kenny. Andy, it's your turn.
Libertarians favor restoring and reviving the free market healthcare system. We recognize the freedom of individuals to determine the level of health insurance they want, the level of health care they need, the care providers they want, the medicines and treatments they will use, and all other aspects of their medical care, including end-of-life decisions. On a private basis, what the Van Dyke's Church has done is exactly what I would propose, that we ourselves as individuals have a private duty to provide health care to those who are less fortunate than ourselves. My family provides a good chunk of change each year to local charities in the St. Louis area whose primary mission is to provide for health care for the indigent and for those who lack health insurance that would help pay for their bills.
Thank you. Jay Nixon.
The cost of health care for people that can afford it is out of control. It's costing Missouri jobs for our economy. We live in a state with over 700,000 people with no care, including 150,000 children, up more than 50,000 since this administration has come in with a plan embraced by my opponent. We've turned away over $1.5 billion that you and I have paid in taxes that's now being used for health care in other states. That is simply not smart financially and wrong morally to live in a state where children, a 3-year-old with a fever, has nothing they can do. Far too many situations. So my plan is very clear. Restore those Medicaid cuts. Draw down those dollars. Provide access to all kids. There's about 54,000 of the kids that are already covered under the S-CHIP program. We need to reach out and get those kids into coverage. And for the rest of them, above 300% of poverty, we let those families buy into our S-CHIP program at about $150 per kid per month so that they can afford that. And then we need to increase transparency so that we get actual competition between insurance holders and insurance companies out there. Right now, people don't know even what they're buying. We need to draw down those prices. The average family has seen the price of health insurance go up $2,000, not counting all those co-pays and all that sort of stuff. At the same time, the $1.5 billion has been spent in other states. This is a very real problem. It's not about market forces and tax incentive. It's about using our money smart and helping Missouri kids and families that need our help.
Thank you. Gregory Thompson.
Again, I think we get in trouble every time the federal government gets involved in anything. Our government, private sector is where we need to go for the free market system that we have there. And as we have the free market system going, we need to keep our jobs. We've had over 1 million jobs go out of this country because of NAFTA and CAFTA, which has caused so many of those people not to be able to afford health care as they lose 20 to 50% of their incomes. We've got to keep those jobs in this country. We've got to look for alternatives, and there are alternatives in other countries that the FDA will not let come into this country because money is made by pharmaceutical companies and insurance companies off of people's health. We've got to look to where the money is going right now and stop the outflow of the families so that we can take care of them in state. I strongly support the choice for our people in their health care, and the free market will take care of that.